Good afternoon, everyone. Welcome to EULAR 2023 press conference. Thank you so much for being here. My name is Yulia Kaliskan. I'm EULAR communications manager, and I'm honored to be a moderator during this press conference. Just a short introduction before we start with the topics. You see the QR codes on the table and also on the wall and all over the room. This is for your press releases, which you can access right after the press conference. All the abstracts and topics that are discussed will be available in your press kit upon you entering on your phone this QR code. It also will be available at the press office later on. If you have any questions during the press conference, we will make a little pause after each presentation, and you please raise your hand, and Caroline kindly will provide you a microphone so everyone can hear you. We're also recording it and live streaming it, so people can also hear us on the other side. Our audience can enjoy the question and the answer. So thank you so much, and we will start if there are no questions for this part. Good. It is my honor to introduce EULAR President, Anna Maria Yaknoko, which will present two topics at the beginning of our conference. It's a topic on EULAR's new strategy and individual membership. Please, Anna Maria.
Well, good morning, everybody. It is a pleasure to have you, all of us, with us today, and to have this press conference. I've been asked to present to you the strategy of EULAR for the next 5 years. You may know already that EULAR works following a specific strategy that is present for 5 years, is active for 5 years. We are now concluding the current strategy, referring to the period 2018-2023, but in the last 2 years we have already worked a lot on the new strategy that is referring to the period 2024-2028. We have already finalized all our strategic aims for the current period. So in the meantime, we are finalizing them. We are also developing the new areas, the new guidance for us. Our work, our projects, our developments, our ideas then follow these strategic aims that we have. It is a very important document and based also on the concept of flexibility that is included in the new idea of the strategy. It is a living document. It's not a rigid work that we should follow. It is a living work, a living strategy that could eventually be modified if we see that there is a need for this during the next 5 years. So the current strategy is focused on very clear concepts. First of all, we follow our vision, and the vision of EULAR for the period 2024-2028 is to have a world where all rheumatic and musculoskeletal diseases are recognized, diagnosed, and ultimately prevented or cured. But another important aspect is that to realize this vision, EULAR has a specific mission that is represented by minimizing the impact of rheumatic and musculoskeletal diseases on individuals and societies. EULAR also promotes education, awareness, best clinical care, prevention, and research in the field of rheumatic and musculoskeletal diseases. But most important too, EULAR provides global solutions for the management of rheumatic and musculoskeletal diseases. But all these actions are guided by a set of values. We have very important values that guide us, and these values are fundamental for the development of the strategy. So we have the first value that is crucial for us, that is patient-centeredness. Then we have a second value that is represented by innovation. Responsibility is the third value. But also, as I mentioned before, one of the main values is flexibility. We have also inclusivity, and finally, dedication. What do those values mean? We mean that we have a group, a community of people working with EULAR that are inspired by these fundamental values. We are a group of volunteers who offer our dedication to support EULAR to meet the needs of people with rheumatic and musculoskeletal diseases that are at the center of our activities, at the center of our world. We are, of course, also working in 2023-2024 in the modern area, so innovation is crucial. We cannot go ahead following previous and ancient ideas. So we are open to innovation and to the modern area that we are living. Responsibility is fundamental because all those who work in EULAR work under the concept of a responsibility concept. And we are all dedicated to include everyone who is willing to work with us, to be part of the big EULAR family. So the concept that is crucial for us is the concept of the EULAR family, where we include all individuals, people who want to work, to be active with us as volunteers, and to work together with the other persons in EULAR to develop a world that is following our vision that I mentioned before. We aim at having a world where rheumatic and musculoskeletal diseases are recognized, diagnosed, and prevented or cured. But to realize all these ambitions, we have to focus on specific directions of impact, how to go to these aims and to these plans. The first direction of impact is leadership, scientific guidance, and innovation. This means that EULAR is the organization in the field of rheumatology. And stating this concept less formally, this means that EULAR strives to be the organization for rheumatic and musculoskeletal diseases, and this aspiration towards leadership will be manifest in EULAR's impact of research, education, and treatment. And EULAR aspires to thought leadership in the field of rheumatic and musculoskeletal diseases. The second direction of impact is professional and personal development, where EULAR sets the standards and is the leading provider for career progression and professional and personal development in rheumatology. This means that EULAR will support personal and professional development to improve skills and expertise within and outside our big organization. The third direction of impact is communities. Communities, it means that EULAR integrates individuals and society members into a vital and inclusive community. So EULAR aims to build these strong communities of people that work with EULAR and are representing EULAR and are completely included in our groups that for joint forces to realize their ambitions. And finally, the last but not least, the direction of impact that is also very important is to have a viable income. And EULAR achieves a broad and safe income base for future well beyond 2028. This is our aim. And this means that EULAR strives to secure its economic foundation well into a future where previous sources of funding can no longer be taken for granted. And to achieve this viable income is a precondition for the services that EULAR provides to the rheumatic and musculoskeletal disease community and to the wider world. So in conclusion, these are the concepts that will guide us for the next 5 years. We have already started some implementation of those plans because we have finalized already our current strategies. So we have been very clever, as always happens in EULAR, and therefore we will we have already started some implementation parts. So I hope that this is of interest for you, and I'm open to questions, if any. Thank you.
Thank you, Anna Maria. Do we have any questions? If not, then we can, yes, please. Just a second, we can give you a microphone. Thank you.
Pierre de Waal from Belgium. Do you make some action for the accessibility and affordability of the medication and the cares? Because we saw yesterday in auditorium that the delay for diagnostic and treatment is so long for certain diseases. So what is your action? Are you maybe political action?
Absolutely. We have here our chair of the advocacy committee, who is the best person to inform you about this. Our advocacy committee is so strong and so active in advocacy, both specific at EU level, at European level, but also at the national level. So maybe Loreto is the best person to answer.
Yes, so in advocacy, we are first trying to gather data. She will explain what the RheumaFact project is. So we will be measuring what is the delay in all the different countries. So we have that identified as a gap. And then once we have the information, we will go and put the problem into the higher level authorities. So to say, here you have a problem, it's your problem. Yeah, we know how to do it, but it is your problem. So yeah, we are taking steps towards that. And also making R&Ds a priority, because otherwise it will be very difficult to do so. Yeah.
The price of the medication. The price of the medication is still a problem for many people, and many people in Europe, not only for East Europe, but also, yes. For example, in Belgium and so on, to have the reimbursement for the medications. So.
Yeah, so we are also collecting data on what is available at each country level, and the prices as well. There have been some movements to reduce the price with all the biosimilars and so forth, of course. But the problem is that the price is taken care at the country level. It's very, very difficult to do anything from EULAR. What EULAR is trying to do is to give the skills to the country, the members of EULAR, and how to do this, the same advocacy steps at the country level. So that's what we are trying to do.
And you have negotiation with industry also? Because the price of the medication depends on the industry, of course.
Yeah, but the prices depend on industry with the governments, not with us. Yeah.
Thank you. Loreto.
Morning, Jan Kulhavý from Prague, Czech Republic. Depending on the policy and the strategy of World Health Organization about new threats like COVID, is there any space in EULAR strategy for quick research and quick reaction in clinical management of patients with autoimmune diseases in the situation of new infection, of new epidemic?
Absolutely. EULAR was very active, immediately took actions during the COVID period, and we activated a specific task force to work with for the recommendations for treatment, rheumatic and musculoskeletal patients with rheumatic and musculoskeletal diseases during the COVID period. In addition, we provided material on the EULAR website for doctors, for health professionals, and particularly particularly for patients, how to act, how to do, what to do during this period. So all these has been clearly shown on the website with all indications. Sometimes we had different rules in the different nations, because you have to remember that EULAR is a European organization, and sometimes there are national country rules that are different in many cases. So, however, we gave a global information, and we also refer to the link. We gave the link to the national organization's website in case of any contrast or different actions. But we were very active, and we were also members of the global COVID group that provided also many different activities. For example, they had a repository, they had a registry where people could add their information, and so to have a big the highest number of data on this. So we hope it doesn't happen again.
Yeah. But just in case, we were able to pass a proposition in the COVID report, the EU COVID-19 report, on how to actually face new emergencies and how to use rheumatologists and their knowledge on inflammatory diseases and all our workforce, and how to. So we gave them ideas on how they can handle these problems. We are used to emergencies. Yeah.
Unfortunately, we have to say. But
do we have any other questions? If not, we can move to the second topic, which is also Anna Maria presenting, regarding EULAR individual membership.
So, the main concept of EULAR, that has been developed really in the last period is the concept of the EULAR family. So we are a family of people working all together, and EULAR has become very close to the members, to the national organizations. But to enhance this concept of the EULAR family, where we have the idea of inclusivity too, that I also mentioned for the strategy, we developed these new individual memberships. You may know that we have the members of EULAR are the national organizations and societies of the three pillars of EULAR, that are the Scientific Society for Rheumatology, the organizations of the health professionals, and the associations of people with rheumatic and musculoskeletal diseases in our continent. So these are the voting members of EULAR. But in the concept of the EULAR family of inclusivity, I really want to be all together for the interest of EULAR, for meeting our aims. We have now this individual membership. So each person, each individual who is interested, of course, can become a member of EULAR. We have developed as a first step what we call a blue membership type. And this has been developed starting from January 2023, when this blue membership is available for any individual who is applying for this new membership. Of course, people should have a specific criteria, and sometimes also national organizations have put some criteria in addition to the others. For example, in some few cases, the national organizations requested that before becoming members of EULAR, they should before be member of the national organizations. But this was a willing of a few of them. The majority were not following this concept, and so the individuals of their countries can apply for the EULAR membership. What is the advantage of becoming a member of EULAR? The membership covers a period of 1 year, from January 1st to December 31st each year, and they can become, being members, they can have access to the EULAR app, they can have enhanced information about EULAR and all the activity of our organization, they can have a discount on a Congress ticket at the next Congress of EULAR, they can have a certification of EULAR individual actual membership, and they have also the eligibility to apply for rural committee member involvement. We said before that our committees are composed of members that come from all over our countries that compose EULAR, and therefore they can become members of the committee. So, how to join, how to apply? You go to the website for those who are interested and pay the membership fee that is 100 euros per year. And once the requirements are met, they become members of EULAR. So the membership of EULAR has the aim of inclusivity, of giving the feeling to the persons that compose our community to really to be members, to be inside the society, to be working in the society, to be members of the EULAR family.
Thank you, Anna Maria. Do we have any questions? Not. If not, then we can move to the next topic. Thank you again, Anna Maria, for the presentation. And I'm delighted to present EULAR Advocacy Committee Chair, Professor Loretta Carmona, which will be presenting the topic on comorbidities with RMDs. Please.
Okay, so thank you very much. You have the press release if you want to read it in full, but basically I will summarize what the problem is. So when you think about rheumatic and musculoskeletal diseases, you basically think about pain and age, and like it's not given a high priority usually, and actually was not present in the non-communicable disease initiative. Rheumatic and musculoskeletal diseases did not appear there. But the problem is that they do not come alone. They come with comorbidities that are actually related to complications of the disease and also to underlying risks. This means that if we rheumatologists were not trained to treat all the comorbidities and all the complications of these diseases, a lot of people will be dying of rheumatic and musculoskeletal diseases. So today, I don't know whether you are aware, but at the EU Parliament, the ENVI Committee is presenting a hearing on the NCD report. And I think this is a great moment to reflect on the topic of the connection between RMDs and inflammation and cancer, cardiovascular diseases, and mental disease. So we also have a very good press release on long-term risk of targeted therapies, which is reflecting the interest of the rheumatologist to actually disentangle this relation between treatments and the other underlying risk of inflammation and cancer and cardiovascular. So I can take any questions now.
Please, if we have any questions to Loretta, just raise your hand.
Sorry. Pierre Doual from Belgium. The question about cancer and cardiovascular disease is related with the treatment is a real concern about the patient and the rheumatologist. But what is your position here now with the results we have now for these diseases?
Okay, so you have. Let's go first for cancer. Okay, so we have the inflammation. We have inflammation by itself increases the risk of cancer. Okay, so what we have to do is to decrease the inflammation. Now there are some therapies by the way they work also increase the risk of cancer. So what we need to do is to reduce the risk by controlling the disease without increasing the risk with the drugs, right? The results that we have for the JAK inhibitors, which is the drugs that now are, we have more concern about, are reassuring that they are not really increasing the risk, because most of these patients, what they have is an underlying risk for cancer. So far, the numbers are very large, and the increase of cancer is very, very small, and still could be related to other things. So what the message that we take, the rheumatologist, is if a patient has inflammation but no other risk for cancer, say genetics or previous cancers, then we can safely put this patient on JAK-inhibitors. If this patient has a higher risk of cancer because of other things, and the same applies for cardiovascular problems, then we will use any other medication. Okay, but so we basically treat safely as much as possible.
Your advice, so a surveillance, specific surveillance for this patient treated with this specific treatment?
Okay, so we are very keen on surveillance. In fact, we started the registries the moment we had the first targeted drug. So we are very keen on surveillance and registries and all that. So we are very keen also on recommendations on how to follow up patients with high risk of cardiovascular diseases or high risk of any other safety concerns. So it's almost automatic. It's not because they are on JAK-inhibitors, it's because they are a patient with an inflammatory disease. So we will follow them, yeah.
Any other questions? If not, then thank you so much, Loretta. And we go into the next topic of our press conference. I'm happy to introduce Dr. Anna Molto, EULAR Research Subcommittee Chair for Public Health and Epidemiology Research, who will be presenting RheumaFacts.
Thank you very much to everyone. So as we all know, the burden of disease with patients with rheumatic and musculoskeletal disease is the leading cause of disability. And therefore, despite we have increasing number of available therapies, this burden keeps increasing. And there might be several reasons behind this: the aging population, sedentarity, environmental factors. But one of the reasons behind that might be inaccess or different access to care in the different countries over Europe. So based on this, in order to try to disentangle what are the causes behind the increasing burden of disease and to see whether inequities in access to care is actually one of the reasons behind it, EULAR decided to launch the RheumaFacts project. So the RheumaFacts project is being constructed to be a unique data repository in which we will include all facts and figures that we think are relevant for explaining and describing the current realities on current care for patients with rheumatic diseases. So for this, we will use already available data that's already out there, data from socio-demographic factors, economic factors, environmental factors that are available in different databases about WHO, OCDE, etc. But what makes this project unique is that we've liaised with all the national scientific societies of all the EULAR countries in order to collect data on workforce, on access to reimbursement, on practices, how many nurses, how many patient organizations, how many drugs are reimbursed, what's the delay from a GP to a rheumatology consultation, to have this overview of what's the rheumatology reality across Europe. And of course, we plan to do this over several years, so this will not be a one-shot. So we will create this product that will be the go-to place if you want to have an overview on what's going on with the rheumatology reality. And we foresee that we will have 3 products. We will have these very interactive, easy-to-get maps available on the website. We will also have an advocacy product for Loreto and her team to go and lobby in Brussels, but also at the local level. We anticipate that this will be a positive side effect of this project. So countries that are really very well organized, they will have this data, but some countries are not organized, so this could be an unique opportunity to learn how to gather this very relevant data that might help them at the local, national level. And of course, we will have this scientific product that we will get to see what's the reality of the workforce, for example, and how do we foresee the replacement of rheumatologists, for example, in the upcoming years, which is a real concern because it really directly impacts the burden and the care of our patients. And I think that's it. I'm happy to take any question.
Do we have any questions? If not, we can move to the next topic. Thank you so much, Anna. I'm happy to introduce Elsa Mateus, Dr. Elsa Mateus, Vice President PARE, which will present the topic of EULAR impact of R&D survey. Please, Elsa.
Thank you. Well, it's my pleasure to talk about this project that, in line with the EULAR values, brings forward the patient-centeredness vision. So the EULAR impact of RMD survey brings together, as usually in EULAR, the best science, also with the patients and the people with RMD's experience. And therefore, this project is designed to collect data directly from the patients and from the people suffering with rheumatic and musculoskeletal diseases through an online survey. And we aim to capture the patient-provided information to help us understand how these diseases have real impact on patients and people's life across Europe. This will also help us, we believe, to identify healthcare gaps and unmet needs. And for this, we will go directly to the patients, to the persons who really navigate through the healthcare system and face the real problems in the real world. So we have involved, of course, the input of patients and patient research partners when building this survey. And a baseline survey will put together also several standardized questions related to the people's diagnosis and how it will impact their quality of life. And this first baseline survey will be later on followed by additional surveys on a biannual basis, allowing us to have a longitudinal observation. So this is, in our view, an added value for this initiative and for this survey. And we also believe that this data collected will be a very important resource for researchers, healthcare professionals and providers, and also for patients, of course, because they will be providing these valuable insights of the burden of disease, and therefore it also will help us to improve the overall care of people with RMDs. It will serve as a monitoring tool also for disease trends and treatment patterns over time, and this will be certainly very helpful to guide clinical practice, policy decisions, and of course advocacy also activities. So, and we aim in the future for this survey to be available to all relevant European and EULAR languages, and that's what I have to present now. Thank you.
Thank you so much, Elsa. Do we have any questions? If we don't, then we can move to our final topic, which I'm happy to introduce Professor Jette Primdahl, Vice President HPR, and she will be presenting topic on managing anxiety and depression in arthritis. Please, Jette.
Thank you. Well, as you've heard, we focus on treating the inflammation, and despite this treat-to-target approach that also everybody in Europe has, many of the patients still suffer from pain, fatigue, sleep problems, and anxiety and depression as one of the comorbidities, as Loretta also mentioned. And I'd like to draw your attention to the abstract on self-management behavior, anxiety, and depression in patients with inflammatory arthritis. It's a cross-sectional nationwide study among more than 12,000 Danish patients with inflammatory arthritis. It was one of the abstracts that had the HPR Abstract Award this year. And we know that poor mental health is associated to poor health, so that's why it's such an important area. And in this study, they performed, they sent out a survey to more than 12,000 people through the Danish national quality database called DanBio. And I think that the results are kind of shocking, although we also knew it in advance. The prevalence of anxiety was high, as high as 34.5% in people with spondyloarthritis and 22.1% in people with rheumatoid arthritis. And also depression was more prevalent among people with spondyloarthritis compared to those with rheumatoid arthritis. It was 27.3% compared to 18.6%. So really a lot of people suffer from anxiety and depression. And the prevalence, I mean the number who suffer from anxiety and depression is sort of linked to age. Younger people suffer more from anxiety and depression, women more than men, and also those recently diagnosed, maybe they are more insecure how to manage their disease, and those with basic education compared to those with higher education. And the problem is that those with clinical anxiety and depression, they have lower self-management behavior, such as lower adherence to treatment. So that means they may not take their medication as they are prescribed, actually. They find it harder to engage in physical activity and take an active role in their own health in general. So mental health is really important for the patient's ability to manage their arthritis and manage the impact of their disease in everyday life. These numbers, we know them, it sort of resembles those from other studies, and I think it really indicates that we need a systematic approach to screen our patients to identify those who suffer from anxiety and depression and refer them to appropriate authors. And we may need to develop new types of interventions to dedicate to these patients. Yeah. This abstract was presented this morning, so there will be access to the presentations after the conference, so you can see it there. And the problem with mental health was also addressed yesterday in a session on newly diagnosed with rheumatoid arthritis. There was a patient representative giving a very touching speak about his journey in this, and he also told about how he sort of dived into a long time black hole there. So it's really something we need to do something more about. Yeah. I'm happy to answer questions if there are any.
Do we have any questions? Yes, please.
Romain Loury from Igora, France. I would like to know to Yet Primdal, but also to Loreto Carmona, regarding these comorbidities, mental health, cancer, cardiovascular problems, are rheumatologists aware enough? Do they do enough for this? What is EULAR point of view?
Well, I'm also involved in the cardiovascular risk assessments, and I think it's described in the EULAR recommendations that it is a responsibility of the rheumatologist, but they may collaborate with general practitioners or other healthcare professionals, but they have a responsibility to identify and be aware of the risk. And how it's managed, it's very different across European countries, and whether you have resources to focus on it. And I think the mental health, that may be less noticed by the rheumatologist because it's not something you can do exactly. But I think we need proper tools to help identify those people who need professional support.
Yes, so for more than 2 decades, you come to the EULAR congresses and you see a lot of posters and sessions on comorbidities, because for us they are very important. But as Jette mentioned, mental disease is less picked up by rheumatologists. We are very conscious about cardiovascular diseases, cancer, lung problems, skin, eye, etc. And we also have even interdisciplinary care with the rheumatologist and an ophthalmologist, a rheumatologist and a lung specialist. But yes, it's still a problem. And it depends also on the country, on the time, resources, etc. I want to pinpoint you to the EULAR advocacy materials, because we have 3 brochures that might be very interesting for you on mental health, cardiovascular health, and cancer in relation to RMDs.
No, I wanted just to add that I think what we struggle as rheumatologists is how to implement these recommendations. I think there's a lot of work to do on how these recommendations do apply in the different realities of the different countries. So I think we've raised awareness over the last decades, but now we really need to move forward on how to really implement and these recommendations into real practice. And I think that that's a challenge.
Yes, please, we have another question. Right?
Thank you, Pierre Doual from Belgium. Do you think that co-consultation with a psychotherapist could be interesting?
Which station should... I didn't hear it, the first part.
Yeah. Do you think that co-consultation with a psychotherapist can be interesting for the first consultation also?
Yeah, that might be something we could look into. I guess you should perform research to find out the proper way to offer it. We are also locally in Denmark trying to educate the nurses and other health professionals to address the mental health issues in an appropriate way, and it seems to be something that can reduce the anxiety and depression as well. But I think there may be many different ways to do this.
Yes. The departments of rheumatology that have a psychologist in the team actually perform much better, not only because the psychologist helps with the more difficult problems, but because the psychologists train the team to cope with some of the problems and to identify whom should be referred to psychiatry or others. Yeah.
But I think just to complete that, just to go back to what you were saying, I think that in the implementation idea, we really need to start systematically assessing it somehow, because when you see the proportion in our diseases, systematic assessment of comorbidities in general, but mental health needs to be implemented. And I come back again to the implementation, but the systematic screening, I think, is the key. And then, depending on the realities of the departments, see how to move through. But at least assessing systematically, I think that's one of the key points.
I believe these aspects are crucial, and I agree with Loreto that where a psychologist is present in the departments, the problem, the patients have better support and better outcome. But also, what the problem is that there is a big inhomogeneity in Europe because we have different countries. And each country has different rules, but also at a national level, each department have a different way of working, depending also on the economic support, of course, of the health system. But for example, in my department, we have a psychologist who works with us, and we have very, very excellent nurses who support the patients, and patients feel much more comfortable, I think. But this is a question for Elsa that I would like to ask her. As far as we know, our patients feel closer to the physiotherapist, to the nurses, to the health professional in general, and they help also in finding the link with the psychologist. And when we have this kind of setting, as far as we understand from our patients, they're much more happy, let's say, they feel much more supported, let's say, more than happy. But maybe Elsa wanted to add.
Yes, it's true. I think for patients it would be very...
The microphone.
Oh, it's...
Yeah, it's on.
Okay. I think for patients it's very relevant to have a regular assessment of emotional and psychological status. And this should be done from the first appointment. So there could be a follow-up. Because you were mentioning 3 topics that are very difficult for patients to handle, which are risks. Patients don't only have to handle and to deal and to cope and to find strategies to deal with the rheumatic condition. They also need to fight these fears of having risk for cancer, cardiovascular risk, and also the trying to cope and deal with the mental condition, because RMDs have a huge impact also in emotional and psychological well-being, because they have effect, and this is one of the aspects we are also trying to assess on the survey, the impact of RMDs on the patient's life, on the person's life. It's much more than biological and just at the molecular level. So we also we need to learn to live with the fear and the risk, and the cardiovascular risk and cancer risk and mental health issues. And mostly we also, patients, need to learn when to ask for help, because sometimes they don't mention, particularly when we're talking about anxiety and depression, they quite often don't ask for help with their rheumatologists. So a way of addressing this could be, for instance, have a regular assessment and we know we have a lot of validated instruments for that. But surely we also need to advocate with patients to face these fears and learn the best way of facing these risks to live a better life and also to take a better care of themselves.
If I can add something, but before I would like you, Elsa, to confirm what we understand as clinicians, also from our patients, is also another problem, the fact that they have to take treatment and medicines chronically. And this is also another worry for patients, because even this fact of having a lot of treatment means that they have to go frequently to follow up, to make assessments and analysis and so on. And this is it's true that our treatment now are very effective. We have many options, but on the other side, it's also true that is a problem to take always per specific treatment that can involve also patients also in the daily activities. But maybe you have to confirm or not. This is our feeling as doctors.
It is also true, because this is an issue, because treatments are quite effective nowadays, and we manage to have our condition, our RMD under control, under remission, but then we need to face comorbidities, side effects of treatment, and we need to learn how to deal with all these factors. And it's quite challenging to think about this. Yeah.
And I think that was exactly what was shown in this study that I referred to, that if you are suffering from severe anxiety and depression, then maybe you don't take your medication as expected, and you may not engage in physical activity, you may smoke more, so you increase your cardiovascular risk and the inflammation may be higher. So we need to be aware that, like Emma Duras, psychologist, said last year, there's no health without mental health. I think that's very essential, actually. So we do not reach the goals for our treatment if we do not address the mental health issues.
Thank you so much. We have another question. Yes, please.
Thank you. I'm Jo Debray from from ASIF, the International Federation for Axial Spondyloarthritis. And I just wanted to comment on the fact that we're really aware of the issues of mental health and people suffering specifically from AXPAR. We've run a programme recently called Talk to Be Heard, and it's about trying to get patients to talk about what is happening. So it's not just about their physical health, but it's about their emotional health. It's about the impact that the disease is having on their family life, on their relationships, on their work, on their mental health. And we create things like a discussion guide that helps patients actually prepare for their rheumatology appointment and go in, because we know that so often they'll go into an appointment and everything goes out of their head, and they also are really nervous about talking about their mental health with their rheumatologist, because often I think they think their rheumatologist is only interested in their physical disease as opposed to also then their mental health. So I think it's so important to actually consider all the different aspects of mental health and emotional health with the RMDs.
I think when you're living with the chronic disease, you need more than a biomedical perspective. You need to be approached by a biopsychosocial approach, actually. So, yeah.
Thank you so much. Do we have any other questions? If we don't, then we thank you once again for your time, for your questions. We wish you a wonderful congress, insightful, enjoyable. And just another reminder, all the press releases will be available on your press kit. Please scan the QR code and you can access them already after the press conference. Thank you. Thank you, everyone. Have a nice day.